Hey all, good morning. It is bright and early. We left the house at like 4:30, but Scarlett is getting her hardware removed from her legs today, so she has surgery. We're on our way to Children's in Denver to get that done. So like a year and a half ago, she had surgery on both of her legs. She had a muscle release in the lower legs, and then she had plates and screws put through her growth plates to correct some deformities in her legs. And that was a very great success. It's done its job. So now we're going to get the hardware removed, which will be great in the long run. Here goes Scarlett Cam.
Scarlett Cam. Like she said, getting hardware removed. We're gonna yeet the hardware into orbit. Yeah. And, I also got a cat dog.
That is
Cat dog!
And Scarlett, did I ask your permission to share this?
Of course she did.
What?
I chose to be on this.
Right. Why do you want to share this with people on YouTube?
Because I want to show other kids that just because you have a rare disease doesn't mean you can't be a kid, and doesn't mean you can't have fun and can't play and make friends.
That's right. All right.
Yeah.
Give them a peace sign. We'll talk to you later.
Yeah.
Hi. Are you all
Hi.
checked in?
Yeah.
Were they nice?
Yeah.
They got a weighted blanket. They got this cool light set up. It's dim lights and everything, and everyone has been
And look
very
up.
nice.
So cool, look up.
Ooh, ah. They're really great here at Children's.
And I'm watching Mr. Beast.
Perfect. Hi, Scar. How are we doing?
Good.
Was surgery perfect?
Yeah.
Yeah. Are you in pain or no?
A little.
A little. They got you good pain medicine, right?
Yeah.
And you only need a tiny bit of oxygen.
Yeah.
You ready to go home?
Yeah. And I'm drinking juice and eating
Goldfish.
Yeah.
Yep. Let's go to Starbucks, yeah?
Yeah.
Okay. Look who just scooted up the stairs.
I scooted up the stairs on my butt.
I think she still kind of has the medicine in her system, and her hair's a little crazy. But she said she missed us and she scooted up the stairs. Mind you, we had to lift this whole child in and out of the wheelchair and in and out of the truck on our way home. Are you happy?
Yeah.
And she was able to come up with her oxygen too, so that's good.
There's a kitty sniffing me.
Do you think she missed you?
Do I smell weird?
I bet so.
Do I smell weird, Gertrude?
Twerk it, girl. Twerk it, girl.
I don't like this.
I'm sorry, Dad.
Good job, good job. Good. Hey, extra challenge.
Yeah.
You rocked back, which was awesome. Try to lift your toes. You rocked back. Good. Squish it the whole way. Lift your toes. Ow! Loved it.
No, don't like it.
Okay, that's okay.
I don't
You
like
did
it.
so well.
Hey, that was worth trying, right?
You're doing so great.
But listen, your heel was all the way on the ground, so flat that you could lift your toes.
You're not doing it right. You're not
So
doing
range
the screen.
good.
You're not doing the screen.
Awesome.
You're doing the screen.
I'm out of breath right now.
You're gonna have to blow up the balloons and take some big breaths.
Okay.
Who said PT can't be fun?
True. Pain and torture, or is it the P and T and party?
Party, arty, arty.
Exactly.
Good morning, Scarlett. We're 1 week past your surgery. Sorry about the dishwasher in the background.
Well, technically, it's 1 week and a day.
No, it's exactly 1 week. Today's Monday and you had surgery on Monday.
Oh, right. Yeah, you're right.
How are you feeling?
Great.
Great,
Drinking
really?
some horse's chata.
She calls it horsey chata. It's horchata. Is it good?
Mm-hmm.
So how do you think your recovery has been?
Difficult, but it's starting to get better. Honestly, one of the hardest parts right now is, as you can see on my knee, the steri strips are starting to come off, but I'm allergic to adhesives.
Yeah, she's very sensitive to adhesive, so don't show, but even where the leads were on her chest, it's quite irritated. So we've been doing like Benadryl and stuff, right?
Like right here on my knee.
Yeah.
Terrible allergic reaction.
But I don't know if we mentioned on camera, but the surgeon actually did a scar revision. So they took out her old scars because they had started to keloid, and they did a scar revision. So her incisions actually look a lot better. You happy about that?
Yeah.
What do you think you would tell other people who are going to have like orthopedic surgery like you just had?
Yes, it is hard, but it'll make you so much better. You'll be able to walk better. It might be hard to move around and walk, and you might feel a bit depressed because it might make you feel a bit trapped, but as long as you have people to support you, you're fine.
That is true. Now, physical therapy is hard, right?
Yes.
You didn't want to do it.
No, I didn't want to do physical therapy because it's a bit painful.
But you've already had a couple of sessions of physical therapy, and I think it helped, right?
Yes, and it helps that my physical therapist is very, very friendly.
She is very friendly. And you had been using a walker at first. Are you still using a walker now?
Nope.
Do you want to show our friends how your walking is going or no?
Yeah. It is a bit hard to walk because you have trouble balancing.
Blind mom trying to track.
Yeah.
But she's doing very well. I'm very proud of her. What do you think the importance is to continue walking?
Because if you don't, you won't be able to walk again.
Will you get stiff and stuff, you think?
You'll get very stiff.
Yeah.
And that'll make it hurt more.
So compared to having the screws and plates put in and your muscle release, how do you think this compares to that?
Much easier.
Much easier?
Yeah.
Yeah, because you don't have casts this time. So that's really nice.
Last time I had to have casts.
Yeah. And she hasn't been able to run or jump for about 1.5 years. But in about 4 weeks, guess what?
I'll be able to run and jump.
Yeah. Are you looking forward to that?
Yes.
So what are your plans for the day?
I'm gonna play outside. I keep on seeing this toad wandering around. I named it Mrs. Croca. And every time I say her name, I gotta say it like this. Mrs. Croca. With that accent. I gotta say it with the accent.
Okay, that's very important, right?
Very important.
Oh my gosh, you know what? Something I have noticed during this recovery?
What?
You've been eating a ton.
Yes.
I guess because you've needed like the energy to heal, right?
Yes. You will need to eat more during after surgery when you're recovering because you use a heck of a lot of energy.
And I'll give y'all some updates about the anesthesia in a little bit, but it was quite the undertaking.
My cat's in the background grooming herself.
She's so cute. All right, any last words to our friends?
Bye-bye!
Okay, I'm in my bathroom just because I wanted to share a little bit about my perspective with this procedure, but I didn't want to burden Scarlett with like adult emotions, so I didn't want to be overheard. So for the procedure, she has a form of mitochondrial disease, so we have to be very careful about the kind of fluids that she receives and about the kind of anesthesia she receives. So they had a difficult time sedating her because of her, just the way her metabolism is and the contraindications with anesthesia. So with anesthesia, you have like your induction, and that is when they initially put you to sleep, and then they have medications that keep you asleep. So usually people use a medication called propofol, but that can be difficult to metabolize for people with mitochondrial disease. So what they did is use a small one-time dose of propofol for induction of anesthesia, but they ended up having to use a lot. So they used Versed, fentanyl, propofol, Precedex, and ketamine, and she was still moving around. And because this is an orthopedic procedure, she did have to be very still. So to be clear, just because someone is moving around doesn't necessarily mean that they are experiencing pain or that they are like conscious, especially when you have like a neuromuscular disease. But because they needed her to be very still, they did go ahead and give her something called rocuronium, which is a paralytic. So she had all of these medications, and then right when they got her to sleep, her blood sugar did drop, which does happen. She has hypoglycemia. We are aware of this. We have to be quite strategic about how we do anesthesia because of the fasting. And it used to be that she would have to be admitted to the hospital the day before and have an IV placed and run sugar water essentially until the procedure. She does not have to do that anymore because she can go on clear liquids and fast from this for 2 hours, and that's all she needs to do. So they did start the IV right away. I have to say they did incredible. They read her adaptive care plan. They had the lights down low. They had weighted blanket, and everything was very calm. They had child life. Like, I could not ask for better. And they did the procedure. They did go ahead and bolus her. So usually people would have like dextrose 5%. She needs dextrose 10% to maintain her blood glucose. So her sugar dropped. They bolused the dextrose because it was dropping very quickly, and then we kind of overcorrected a little bit, which is fine. But she did have a little bit of high blood sugar in recovery, and then also just like pain is difficult. So she did come into recovery, and she was struggling a bit emotionally because that happens with ketamine. I think it probably happens with everybody with ketamine, but specifically with her with ketamine and just all the medications that she was on. And there was a scary moment because she was on a ventilator. Most people are on a ventilator when you have a procedure done. So she was on the ventilator. They extubated her, which means they took the breathing tube out, but she wasn't breathing well on her own. So they had to place something called an LMA, which is kind of like a plastic piece that sits in your airway and props everything open. She does have obstructive apnea. So she is actually 2 days after her surgery, she got fitted for her CPAP mask. So we are starting CPAP with her, and they just were like, she definitely has apnea. So make sure that you attend that appointment so we can get that CPAP going as fast as possible. And they really waited to remove that LMA till she was like gagging, really, really, really awake. And then she did require oxygen for a few days when we got home, which is completely normal for her. Not a big deal. But what I do have to say is that she's 5'2", 120 pounds. I'm not that much bigger than that. I think I only have maybe 12 pounds on her. So lifting her has become difficult. So again, on this channel, I talk a lot about my training and fitness, but this is my first why. When I met with my coach, he had talked about this. Outside of competing, I needed to have a separate why. Why am I doing this? Why do I want to be strong? And this is always and forever going to be my first why, is because Scarlett needs me, and she will probably need me in some way, shape, or form for the rest of my life. But I want to be strong for my daughters, and I want to be able to run around with my grandchildren at someday, way in the future. But I just want to be healthy and strong. So anyway, that was a challenge, but we made it through. She's doing very well. I'm so proud of her. And the best thing is her orthopedic surgeon said he doesn't really foresee her needing other orthopedic procedures at this point. So that was really great to hear. I do want to talk a little bit about PTSD. This is my self-diagnosed PTSD, but it's hard being at a hospital, and it's hard knowing that she's going to be on a ventilator because she has gone into full respiratory failure before, and she stayed intubated for a couple of weeks in the PICU at one point. So it is difficult for me. So parents, like, make sure you're checking in with yourself. Make sure you're caring for yourself. You're talking to the people who love you. My mom is a nurse, actually Nurse of the Year. I'm not trying to brag or anything, but it was very helpful to be able to check in with her because she experienced these things with me as well, and tell her how I'm feeling. I do check in with my husband as well, but he's kind of on the same journey as me. So all that to say, she's doing quite well, and I'm really proud of her, and I'm glad this is over. And thank y'all so much for joining us and watching this video and just supporting her and supporting me. And until next time, happy homemaking.